Joining us now is the medical director of the Medical Intensive Care Unit at Harborview Medical Center in Seattle, Washington, Dr. James Town, and Dr. Nathaniel Schlicker, an emergency physician in the Tacoma, Washington area, and a spokesperson for the American College of Emergency Physicians. Both of them have been treating coronavirus patients. Doctors, we thank you both for being with us. And Dr. Town, perhaps we start with you. How are your patients doing, broadly speaking?
Well, thanks very much for having me. Broadly speaking, Harborview is in downtown Seattle and hasn't been hit quite as hard as some of the other area hospitals. So we have still a couple of patients who are critically ill, and then a couple who are on the acute care service who are hanging in there right now.
Dr. Schlicker, one of the questions we get often is about concerns for people in the medical community. And I know that two members of the American College of Emergency Physicians are in critical condition because of the coronavirus. I know someone here in New York who is an emergency room physician who is in quarantine at home and is having flu-like symptoms. What can you tell people both about their concerns for people like you who are treating coronavirus patients, but also for their possible exposure if they go in?
Well, that's an excellent question. For those that are working in the ERs, we've always been at the front lines of various pandemics and infection, and we live with the flu every year. What I tell them is, use your best precautions, work to use your PPE, and recognize that we need to adapt as this crisis moves on. We're already looking at our high-risk providers, those that are in the age category or have other underlying medical conditions such as chemotherapy or ongoing needs, and pulling them off of our front lines and sending relatively younger emergency physicians like myself to the front lines to try to reduce the risk to all of our staff. For those that are thinking about coming into the emergency department, I have to echo what many of your guests have already said today, which is that if you're not in need of critical, high-level intensive care, don't come to the emergency department. We've set up virtual visits here in Washington. We have got the process going to build drive-through clinics and a lot of other resources. If you're worried about getting the coronavirus or having it, coming to the hot zone of the emergency department where we're taking care of the sickest and the most critically ill is not the best plan unless you really need it.
Let's see if we can get to a few viewer questions. Dr. Town, maybe you could take this one from Gail, who asks, we have 3 hospitals within about 5 miles. Wouldn't it be prudent to make at least one reserved for non-COVID-19 illness so that people who are weakened by cancer or heart illness have a better chance of recovering? Direct all flu cases to other hospitals or clinics? Dr. Town?
Yeah, that's an excellent question. I think the reality is that we're all worried that all of us in every hospital everywhere will be taking care of patients with COVID. And so I think, the nature of the question that we need to try to isolate patients with COVID or even suspected of having it from other patients, particularly those at high risk, is right. But what I think needs to happen is that each hospital has to figure out the local solution to do that on a hospital-by-hospital basis. Meaning, like here at Harborview, we've established COVID wards where patients with COVID or suspected COVID can be isolated from other patients. But I think it's difficult to say that a COVID patient won't show up in your hospital and then to sort of enact a transportation scheme to move them to another hospital. I don't know if we're going to be able to have that kind of organization. From a regional standpoint, we are also trying to think about how we best distribute our resources so that we can care for all the patients in the region. And so in that way, we sort of need to have access to all the hospitals in every area that's capable of taking care of these patients. So isolation is important, but I'm not sure that we can do it on a hospital-by-hospital basis.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.